speaker is Mr. Syed Mahbubal Alam. He's technical advisor of the Union Bangladesh, a public health and environmental expert, and working on policy advocacy issues for over almost 2 decades now. And he holds a law degree from World University of Bangladesh and an advocateship from Bangladesh Bar Council. He pursued global leadership in tobacco control course from John Hopkins and also the advocacy training from Advocacy Institute. He is founder of the Center for Law and Policy Affairs, a policy advocacy and research based NPO organization, and co founder of Save the Environment Movement, a leading civil society organization in Bangladesh. He had served as director at WBB Trust, a policy advocacy organization, and legal expert on tobacco control law and policy drafting committee of Ministry of Health and Family Welfare of Bangladesh. So welcome, Mr. Alam, to this symposium. So we wait for your presentation. Thank you.
Um, Thank you very much. Good afternoon, ladies and gentlemen. It's really my honor to join this conference. So, you know that in Bangladesh, in Bangladesh and India, we have the very similar so many things. One of the challenging thing in Bangladesh is the random selling of the tobacco in everywhere. You find everywhere people are selling tobacco. And the selling tobacco, there is only not the problem. There is another problem. They are involving the minors and industry. When the government decided to ban the ad, then the industry start using it a promotional work, using that portion. So we are thinking to start the introduce licensing. So let's explain that why licensing is important. The main purpose is that one. It is we want to reduce the easy accessibility of the tobacco product, because as I say that one, you'll find a lot of tobacco selling around the school, hospitals, and very nearby. Random selling, the company marketing, now the when the tobacco advertisement banned, now industry using them for the PSU mainly. PSU type of tobacco advertisements mainly operate by the small vendors. We are trying to ban the small tobacco sales around the 100 meters education institute and health institute. Besides that, we are trying to implement the few section of the implementation of tobacco control law, like the advertisement, ban sale to the minors, and picture warning on the tobacco products. So this is the one of the things that we are thinking that how to implement, and then we are thinking to introduce the licensing. And another thing that one, we are trying to involve the local government in this process. Thank you. Next, please. So when we started that one in Bangladesh, there is so many things. We start thinking that introduce licensing in 2016. Then one organization is called the Aid Foundation. They came forward and they submitted proposal to the union and the Bloomberg for introduce licensing in the 18 municipality and 5 city corporation in the 12 district 22 district of 2 divisions. So this was a model project we developed in 2016, and we are planning how to implement that one. That was a very small risk program. We have, because that in Bangladesh there is no clear direction in the law about the licensing. So that we taken the model project in 2016, and one of a local NGO is called the Aid Foundation. They take this leadership to start the work. Next, please. So when we start that one, there's a two challenge. One thing is that one, the random selling every place is cigarette is the one of the traditional things in Bangladesh. If you in Bangladesh, you find everywhere people are selling cigarette. Even you find this cigarette in the any grocery shop, small shop, and this is you can see that in the picture. There's a moving vendor who are carrying this tobacco. They are selling tobacco in different places, the public place, transport, and other. So this is the very common scenario and very challenging issue. Another problem is that one, there is no clear direction regarding the licensing, the tobacco control law, and the local government law. We are trying to the central government, as I say, that tobacco control law only regulated by the National Tobacco Design Ministry, and the tobacco control law there is no clear provision about that one. So we are trying to look on the local government law. So local government law, there also there is no clear direction about the vendor licensing or the tobacco control licensing. There is a very small tobacco in the municipality tax to tax guideline. There is the small things they mention about the licensing, but there is no clear things. But there's a huge community, and as you know that the industry has a huge lobbying also there. So it is a very challenging thing. And this kinds of work is not it's not possible to implement by the central government. So we are trying to involve the local government. So in the local government, what we did, we find out the local government has a provision that if anyone run business in the local government area, he have to be obtain a license from the local government. Without license, no one can operate business. So this is tobacco selling also one kind of business. We try to motivate our local government leaders that they are operating a business, so they have to be take the license from the local government. Yeah, next please. So this journey is not very easy. That when we place this argument, obviously the local government people, this is very common, and most of the local government, there's a lot of business are running. They are not taking license, and in this movement, when we raise this issue, the local government leaders looking for the evidence. One problem in that one, the most of the people who are selling this tobacco in the road and different places, mainly they are very poor. They are common logic. They have nothing to do. They are operating business. So communities very sympathize regarding this people. So we conducted a survey and identified that how many people is there. We prepared a list of vendors. We have a lot of advocacy with the local leaders to endorse the memorandum for increased licensing. We, as you know, that the parliament member are centrally work, but in Bangladesh context, the parliament member has very good influence in the local government leaders, local government institute also. So we sensitize the parliament member in our project area. We meet with the decision maker like the district commissioners and divisional commissioners, sensitize them. We work with the media people to support the media, again the media support, create the public support campaign that they support us and sensitize the other stakeholders like the who is the member in Bangladesh. We have a tax force committee in the local level. So we sensitize the tax force committee members, the business owners, the bazar, the market committee, and the other enforcement agency. Then we prepared, and after the all the consultation, we prepared a guideline for the local government that this is the guideline that they can follow for introduce licensing in that area. And we also support the local government to introduce the licensing. So in Bangladesh, two things. Before do any policy work in the central level, we try to work in the local level and grassroots level, very small range, and try to find out the possibility and challenges. So in this area, we introduce this licensing in a one municipality. It's called the Chinoy. It's a very small municipality. We sensitize them and introduce licensing and try to learn that what the challenge we are facing. So that our start the journey, and we are success in the Jinaito. Next, please. So as I say that one, when we before the licensing, introduce the licensing, we have is a very good survey and to try to find out the understand the situation. In our working area, we found that 2022 to 23,022 200 over 2200 unregulated vendors are operating business. So when we show this data to the local government authority that you can get that good amount of tax from these people, and also you can if you can regulate them, and by that way it will be very good support for the public health, and they support us almost as most of the vendors has no licensing, and they also want that the licensing should be introduced because without licensing business it's really so many problems. They are facing so many problems due to there is no licensing. Next please. Um, Another things as I say that one, the vendors, the as industry using them for the promotional activities, so many things that they are providing to the vendors to hand over to um, um, the consumers. So they are working as a mediator. So we find out so many very interesting information from them. Another thing that one. They most of we found that a very huge number of people they are selling tobacco, they are minors, so that is a direct violation of tobacco control law. Next please. So let's that for the focus efforts we that in our municipal project area, as I say that 18 municipality and 5 city corporation, we try to motivate with 200 ward councillors. We meet with each councillors and motivate them to endorse the memorandum for introduce licensing. 10 MPs and 10 Jila Parishad, the local government, one of the local government, they supporting for the license, motivate them that they have, so they endorse the memorandum. Yes, the licensing should be introduced. Then we also meet with the nine district tobacco control law implement task force committee, and they also recommended for the regulate the tobacco selling by the local government. So this is our background work before we before that one we have done, and successfully these people are with us to support this initiative. Next, please. um, After this the things, this is still we are working in the local level. There's the and we successfully motivate 19 municipalities at first to take the 19 municipality authority take decision that introduce licensing in their area. Only the 13 municipality they already implement that decision in their work, yeah, working area. They partially they introduce licensing. It's really a hard job to identify the people and regulate them. And then with this experience, we start working with the national government to introduce a national guideline for the all over the country. Next, next please. Then this is the initiative. We start working the national government. We bring this knowledge to the national government. We will start working with our local government ministry and our Ministry of Health. So we in this journey, our another partners, the CTFK and the grantee also join. Dhaka Sena Mission, one of the our BI grantee, they also joined this initiative, and we support the Ministry of uh, local government institute and the Ministry of Health to draft a guideline for the national guideline for national tobacco guideline for the local government ministry. So it was a long journey. In this time, we faced so many interference from the tobacco industry. Tobacco industry raised so many things. They are opposed that one. This kind of licensing will be a challenged implementation. It will be a create jobless. It will be create corruption. So many things they try to conduct. They also, as part of the rules of business, that kinds of guideline, prepared guideline is a jurisdiction of the ministry, but they try to motivate the ministry to send it for the legal vetting and try to delay this process. So this is a long journey, but as I say that one, we have a huge background work. We try to work with the policymakers. We have the clear evidence from the 13 municipalities. They implement this decision. So we really counter all the TNTI argument what they submit to the different places. Next, please. So this is the consultation. This the drafting committee is first initiated by the ministry and the Ministry of Health and Ministry of Local Government. They also establish a committee, and Ministry of Health join with them. The drafting committee work over the 1 year and collect comments from the different groups, not only the tobacco control, from the different ministries, different stakeholder, and finalize that guideline. Next, please. Next, please. So this is the guideline. If you can see that on the no, please next previous slide, please. So this is the guideline. You can see that on the this guideline, this published by the local government, the guideline. So now we are trying to implement in the all over the country. So we have there is innovation. We are following a method. It's called IOR method. IOR method is a implement a process that we are following for the law implementation. IOR meaning that we are collecting information, then create the awareness, then sending the warning, and then we are drive for the enforcement, and then we are again collecting the reporting and try to assess the situation. We have developed a mobile app. In this, with these apps, we implement in the one of in these apps we already implemented the one division is called pollution division. So we collect all the information. Those people are operating business in the district and sub-district area. We collect their numbers, location, their type of business, all the information, and submit this information to the local government and the district commissioner, those violating the tobacco control law. Next, please. So now we start working for the local government. We
Alam,
already,
you need to
yeah,
wind up soon, please.
yeah, we have established a mayor alliance. So our mayor alliance is now work with us. Mayor alliance for healthy city is a forum for the mayors. So we are now working for the implementation the guidelines. So but we have to. There is so many challenges. As I say that one, lot of people are involved that one. So many people are minors and poor. So that argument is still coming. We are looking, we are closely working with the mayor alliance and the mayors to implement this guideline.